Hello, everybody. Welcome to the Aurora Health Alliance fall quarterly community meeting. We know that Zoom time in your lives is pretty tight, so we'll start on time and end probably a little bit early. We would be remiss if we didn't thank our affiliates. These organizations contribute financially to us and keep our programming and staffing operating so that we can continue to convene to improve access to healthcare in our community. A couple of housekeeping things, you're used to them at this point. Please stay on mute unless you're presenting. Use the chat. Usually when we meet in person, we will ask, is this the first time joining a quarterly community meeting? Introduce yourself. Instead, today we'll ask you to use the chat to introduce yourselves. You can also share programs, resources, and events, including any links for those in attendance. Then when we have our panel, you'll be submitting questions through the chat and we'll moderate those for you. Finally, at the end, we'll be dividing into breakout groups after the Did You Know panel. We know a lot of people attend the Aurora Health Alliance meetings to connect to one another, and that's our virtual way of giving you the opportunity. So for the Did You Know panel, we'll be hearing from Omar Montgomery, from Sierra Lees, from Jack Kopp, and from Tessa Cushman. We'll be going in that order. Presenters, if you have slides, I'll be advancing those for you. You'll also be receiving a chat if you're pushing up against time. So without further ado, to talk about racial justice and health equity is Omar Montgomery, a leader in our community, and he's also the president of the NAACP Aurora chapter.
Good afternoon, everyone. Thank you for having me today. I hope you can hear me loud and clear. Could I get a thumbs up for that? And the Aurora Health Alliance is probably needed more than ever with everything that we have going on today. And we began to talk about racial injustice. We began to talk about health equity and things of this nature. And people say, Omar, where are the stats? Where's this? Where's that? I was driving on 225 today and I exited Mississippi. And upon exiting Mississippi, I began to see camps of people with tents that's their home, that's their residence. And then I went a little further on 225 coming back from an event and came up on 225 in Parker, where you began to see on the on-ramp more tents. And then I'm just driving through the neighborhood. I'm seeing more people on the corner asking for assistance. Those are my statistics. The statistics that at the Aurora Library, where we have a statue of MLK, where at the foot of that statue, we have an unhoused population that's been there for a couple of years. Some of them are actually working, but because of different other types of discrimination, such as a criminal past, such as credit, they're not able to get housing or receive housing. Or in other cases where hotels that are on Colfax are pricing them out of the market because they know that they can take advantage of them. Not all hotels, but some of the hotels. So I just got through coming back from another conversation, and we were talking about this concept of paid family leave. And we were talking about who's truly been impacted by COVID. We know that our Latinx populations, our African-American populations, we see more of them nationwide, not just in Colorado, going into the hospital because of pre-existing conditions, and also the stress of COVID itself and how to deal with the resources or lack of resources there are, that people are seeing an increase in sugar diabetes, hypertension, seeing stress-related things such as heart conditions on top of COVID. So now you have people who are just sick because they do not know what to do and do not have the resources to address these issues. For example, if you stay in an apartment and there are 6 people or 5 people in that apartment because of the high price of housing in Aurora or the increase of housing in Aurora, how are you going to tell someone to social distance when they get sick, especially when we coming up on the flu season? How are we going to tell kids who are looking for a little corner in their apartment to study, but because the parents are doing what they need to do and their other little brothers and sisters are trying to study, that they do not have the concentration they need in a classroom setting in order to retain the information to receive a good grade and progress in school? We are looking at some of the byproducts of what COVID has caused, and it's beginning to show, it's beginning to unveil many of the issues we've been talking about for a very long time. Those kids who do not have equal access to technology such as Wi-Fi, strong Wi-Fi. Why? Because in some of these classes, you have to watch video. How many of you have been in your office and you just watch that circle go on the loop, go on the loop, go on the loop? Or it takes a year to download a document. Imagine being in school and you're preparing for an exam and you don't have a strong Wi-Fi just to do those things. This is what our kids are working with. Or you're trying to apply for services and your internet keeps going down and you got to start the application all over again. Let's begin to talk about those financial resources as well. I remember when COVID first hit and they were saying, hey, come to this place for free testing, go to this place for free testing. I wanted to test it and make sure that it was free. I took a young lady to one of the free testing locations. And they said, yes, the test is free, but to evaluate you and to see that other things are not causing your sickness costs $90 before you get to the free COVID test. I want you to think about that. We in the pandemic, this stuff is spreading like wildfire. And they tell you, you have to pay $90. That's a decision between food, gas, transportation, getting to work, feeding your family, feeding your kids, your current medication, probably for someone that's ill in your house or yourself. These are the inequities that we are dealing with right now. And if we do not have a critical discussion about what does healthcare look like, not in the future, but right now, as we begin to go into the flu season, and they said the next 6 weeks is the most critical time for COVID, the flu, and other things is about to take place. We may have to have another shutdown, meaning that's going to impact small businesses, especially small businesses of color. Not only, we cannot wait on the federal government. We have to begin to look within our state, we'll look in our local municipalities and look in our county governments and begin to see what we can do now to help those who have been unfortunately devastated by this disease. With that stated, I just conclude by this. There are some common sense things I believe we can do. One, I think we're on that path. Total free testing and total free healthcare until this pandemic is over. We need to have what we call a gap fund for people who cannot pay all of their rent and they're able to stay in their homes, because we don't know where the eviction legislation is going to go, if they're going to extend it or if they're not. And last but not least, we have to begin to probably have to retool people for what will be a new type of workforce moving forward. Thank you very much.
Thank you so much, Omar. Joe is monitoring questions, or some questions are coming into her. Joe, do you have any?
Yeah, I did have one question that came in and said, asked what organizations are good sources in connecting residents to address health equity. What are some good resources or organizations?
I think probably some of the organizations, I think on your cover, slide, it had all these different healthcare organizations that's doing some phenomenal work, whether if it's Stride, whether if it's just some of your local public health facilities. If you're looking at housing, and you're having issues dealing with homelessness, you have the Comitis Center, especially, is supposed to get cold over the next couple of days. If you're looking at long-term housing, you have Providence at the Heights. If you're looking at a situation where, hey, I need to work, but yet I need residents, you can look at the Ready to Work program. But I do think when it comes to healthcare, we have begun to improve. Some of our faith-based organizations has been working with some of the healthcare facilities to be satellite locations for people to be evaluated. So I think we need to take that sheet that's on the cover of the PowerPoint and begin to outline the phone numbers and services that they offer so that people can have ready access to this information, not just their emails and websites, but also their phone numbers, because people need to be able to call the traditional way and talk to someone.
That's a great point. Thank you, Omar. And thank you so much for spending, we know your time is so valuable and your crunch for time. Thank you for spending some of that with us. If any other questions pop up for Omar, remember, just a reminder to put them in the chat. So thank you so much.
Thank you.
Now I get the hard job of screen sharing with an audience again. Making sure. Joe, is that the right one? Okay. Okay. Up next, here we go, is Sierra Lees, who is the Campus Outreach Manager with the Alternatives Pregnancy Center.
Yeah, thank you so much. So like you just said, I'm the Campus and Community Outreach Manager for Alternatives Pregnancy Center. Before we get started, I have two people on the call with me that I just wanted to introduce. One is Michelle Chabot. She is our Client Services Director for our Aurora office, which we call our East Metro location. And the second is Laura Johnson, who is our Nurse Manager. So she oversees a lot of our medical personnel, and she's responsible for a lot of our STD care that we do. So here you can see our address for our East Metro location. It's off of 4th. Right now, there are a couple different ways that clients can get in contact with us. They can call us on a regular office phone during hours of operation, which means they're probably going to get to talk to Michelle. They can call our 24-hour helpline and request an appointment or ask any questions, or they can go on our website to request an appointment that way. We're also rolling out a new chat feature that should be coming up in November. We're really excited about. It's live chat on our website. So sometimes when people are experiencing an unplanned pregnancy, they're worried they might be pregnant, or they're worried that they have an STD or symptoms of an STD. It can be kind of, it can be embarrassing for some people to talk on the phone with someone. So chats can be more comfortable. So that chat's going to be open, and a Client Services Director will be able to answer any questions they have or get them scheduled for an appointment. To the right here is a picture of our clinic space in Aurora. I have to admit, I love it. I think it is just big and open and beautiful. We're so lucky to see Aurora clients there. Aurora is definitely our most popular clinic location. We've been in the Aurora area for about 10 years, but as an organization, Alternatives has been in and around the Denver metro area for about 40. We have 3 other clinic locations currently, one in West Metro in Lakewood off of Wadsworth, one in downtown Denver off of 16th and Blake, and another in Castle Rock. And one is coming to the Inverness area actually in 2021. So like I said, though, Aurora is our busiest office. And before I get to talk about some of the services that are really popular there, I just wanted to talk a little bit about who we are as an organization. We are completely HIPAA compliant. We follow all of the clinical oversight guidelines. Our 2 nurses and our stenographer are supervised by 2 licensed OBGYNs, Dr. Martinez and Dr. Schmidt. And all of our counselors are overseen by Kathy Cullis, who is an LPC in Colorado. All of our services on the topic of free healthcare are absolutely 100% free to everyone, no matter of income or insurance or even immigration status. All of our services are at no cost and completely confidential. At Alternatives, our mission is to support men and women and families in the community when they think they might be pregnant or they're worried that they possibly have an STD. So the reason that we do free care at no cost is because we want to reduce barriers between people in the community and the care that they deserve. So if you're worried you might be pregnant, we want you to be able to find out as soon as possible so you can start thinking about your future and what decision you'd like to make. And if you're worried you might have an STD or symptoms of an STD, we definitely want to get you diagnosed and treated as soon as possible. The only thing that we require in our meetings with clients is to see an ID. That's just for our records. We definitely work around it, especially in Aurora, for people who are not documented citizens. So that's something that's really important to know if you're referring to us for someone who might struggle with documentation and is either pregnant or worried they have an STD, is that we do not report to any government agencies on the status of their citizenship. So anything they say in the counseling room or in the clinic is 100% confidential. So next steps here, if you can. Thank you. So we have 3 main program areas in the Aurora Clinic that are very popular. We have a couple other options like fatherhood mentoring or counseling after abortion, but these are the 3 that are most commonly requested in our Aurora office. So we have pregnancy-related resources, free STD testing and treatment for women, and free mom and baby gift bags or material resources. So I'll talk pretty quickly about pregnancy first. So because we serve everybody, we get a lot of different types of people. So we get people who are really excited to find out they're pregnant and who might have been trying to have a baby, but we also see people who are experiencing an unplanned pregnancy. And so those are definitely less cut and dry. And so I just wanted to kind of walk you through a couple scenarios that we see a lot with unplanned pregnancy. So the services we offer are free pregnancy tests, options counseling, ultrasound to confirm pregnancy, proof of pregnancy, and resource referrals. And that proof of pregnancy is really important because it's what you need if you want to get signed up for any sort of benefits or Medicare. A lot of places will charge for that, different doctors' offices, but we obviously do it at no cost. So the types of people that we see with unplanned pregnancy, the first kind of hypothetical client is someone who comes in who maybe she knows that she wants to parent. She's having an unplanned pregnancy, but she's ready to carry to term. Maybe she has other kids. Maybe this is her first, but she has a lot of outside factors in her life that make this pregnancy a crisis. So that could be her issue with like housing, unable to make rent in an abusive relationship, whatever it may be. So she just needs some resource referrals essentially. So we invite her in. Options counseling is basically when there's 3 options for any of us who are pregnant. There's adoption, abortion, or parenting. And so we talk about any of those that she's interested in or none. Sometimes if someone's really in crisis, what they need is a place where they can just talk about how they're feeling about their pregnancy. So what some of their issues are. And then we get her those resource referrals. So if she vocalizes that she is having trouble with like housing, we can get her set up with people with transitional housing or emergency shelter, whatever she needs. The second kind of client we see with an unplanned pregnancy is someone who knows that they are not interested in carrying to term, that they would like an abortion. And we invite her in. We offer her options counseling if she would like it. Again, she can hear all of her options or none. We do have information on abortion. I like to say here that we're not an abortion provider. We do not refer or recommend for abortion, but we are there to support our client, whatever she chooses. So a lot of times what she wants is that proof of pregnancy to take her an abortion provider. And above all, what we value is her autonomy and her anonymity and making her own decision. And the third kind of client we see with an unplanned pregnancy is usually somewhere in between. So we see someone who is maybe just completely caught off guard by this pregnancy. And that's who the options counseling is really valuable for, because she gets to talk about her options in a space where we're neutral. We're not invested in her choice. A lot of people in her life are, they want her to do a certain thing, but she might need a space where she can just talk about how she's feeling. And if she wants that proof of pregnancy to take to wherever, she is welcome to it. And we can offer her resource referrals if she has any questions or needs. The second option is free STD testing and treatment for women. So we have a really robust program full of, I mean, we test for all of these. Sometimes a client will come in and she will say that she knows she's been exposed to like chlamydia or gonorrhea. So we just test for that. Or sometimes we do the full panel. Either way, her treatment is free. We get her prescription and get that paid for. We also treat her partner if any STD is found. So we don't test men for STDs, but if she has an STD, we'll treat him. The last area of service that is really popular is our free mom and baby gift bags, which are my favorite to talk about. It's basically a program where someone can come in, anyone, regardless of income. And if they prove they have a baby with a birth certificate that's 0 to 3 or 0 to 6 months, we give them 2 baby gift bags full of supplies. So it's valued at upwards of $400. So one is packed with diapers, 100 or so, and the other is onesies and blankets and toys and wipes and gift cards and anything else a new mom needs. Our hope for that is that we can reduce some of that financial stress, because having a baby puts you in a very vulnerable financial situation. And so we just want to ease that as much as possible, but also celebrate new parents. And so my last slide here is just my contact information. So my name again was Sierra Lees. If you had any questions about our services, I'm happy to talk with you about them. If you wanted to come to our clinic to take a tour, even if it's a virtual tour or a socially distanced mask tour, we can absolutely do that. And then if you work with women who are pregnant or growing families and you want to refer to us, I can send you more information and more referral cards. And if you think you're a good fit for us as an agency to refer out to for those resources, I'm always happy to get more of those, because ultimately we just want to help our clients be as successful as they can. So we welcome your questions. Either me or Michelle or Laura can answer them. Thank you so much.
Thank you so much, Sierra. I've been seeing some in the chat rolling in, and we'll refer to our questions are Joe.
Yeah, we did have one. How is your organization funded?
That's a good question. So we get some grants from the government, but mostly it's through businesses and agencies and individuals in the community who recognize that there are a lot of people who need sexual health related services. So a lot of it is by donation, and we're really lucky because I mean, there's a big cost to providing all these services for free. So we feel very lucky to be able to provide it.
Awesome, thank you. Another question we had is, who do you work with for adoption options?
We have a couple agencies that are kind of affiliated with us on our resource guide. I'll be honest, I think maybe Michelle could speak to this, but a lot of women aren't interested in adoption resources, but we still will refer out to Hope's Promise if that's something that they express interest in. Usually in the counseling room, we don't push any option in particular, so they do have to vocalize that they're interested in adoption, and we can refer them to a place like Hope's Promise. Michelle, do you have any other places that we refer to?
So specifically, just like we don't refer to specific abortion clinics, we usually don't refer to specific adoption agencies either, because we're not an adoption agency. So in our offices, we have several brochures. Our community resource guide has several different agencies that give generalized information about some of these organizations, and then we can guide them to that information. So mostly it's about education around adoption, so they realize what adoption is, what are the different differences between open adoptions and closed adoptions, helping the education piece, and then empowering them to then take that next step to research some of those adoption agencies.
Thank you, Michelle.
Great, thank you.
Probably time for one more question.
Yeah, got quite a few, so we'll do one more.
And then we'll try to connect the questions to you all so you guys can connect
awesome.
in this meeting.
Do you partner with any syringe service programs who may be able to refer to alternatives?
Michelle, do you know?
No, not that I know of in any of our resource guides or anything like that.
Mm.
Probably an opportunity for us to connect to them.
Yeah, absolutely.
Awesome, thank you.
Perfect. Thank you, Sierra, and to the Alternatives Pregnancy Center. I certainly wasn't aware that this resource was in Aurora. So even though we help plan the quarterly community meeting panels, I still learned something new. So thank you guys so much.
Awesome, thank you.
Up next is Jack Hopp. I've been struggling all day. Is it the Vot-ER program or the Vot-ER program? We'll let him present and let us know. Jack, are you there?
Yeah, I'm here.
There you are.
So thank you for having me. I appreciate it. Like she said, my name is Jack Kopp. I'm a second-year medical student at University of Colorado School of Medicine. A couple months back in the summer, a couple interested students and faculty on the Anschutz campus decided we wanted to put something together for voter registration, both on the campus and then spread into the community. Obviously, with the election coming up and the big thing being voter registration and access to resources for all people to be able to vote. So we partnered with the organization that is Vot-ER. It's an organization that started with focusing on registering voters in the emergency room when they are waiting for their appointments. And some of that has been taken away with COVID, as far as like they used to have iPads in emergency departments, so people could use those to register to vote, and some other kiosk and information. But our initiative, I just wanted to clarify in one of the emails, it was said through UC Health. It's actually not endorsed by UC Health, just wanted to clear that. But it's nonpartisan, and we've been working with both students and faculty from multiple different clinical sites, the VA, Denver Health, Children's Hospital Colorado, and then different graduate school programs on the Anschutz campus. So if you could go to the next slide, please. Like I had mentioned earlier, things have gotten a little bit different during COVID, as far as like not being able to have a lot of face-to-face or tables or in-person materials for people, which has made things challenging. Some of the things that we've found to be more successful for getting people to register to vote, one of these right on the slide is one of our posters that we made. The posters have combinations of the text code, which you can see at the bottom, QR codes, and a URL link. If patients or students, anyone who uses these links, it'll bring you to the Vot-ER website, which is partnered with TurboVote, also a nonpartisan voter registration company. And it takes approximately 2 to 3 minutes for anyone to find out what their registration status is in their state, and also provide them with the resources or direct them directly to maybe a state website or however their state does it to be able to register to vote. In addition to these posters, we've been using a lot of social media with students. I don't know if you saw, but before we started the meeting, I have a Zoom background on that has the link on it. So that's obviously been very applicable in these times. I usually just have that on in all Zoom meetings. And when my camera's off, it shows the link for people to use to be able to register to vote. And then finally, an initiative that we have had in the last couple of weeks is there was a lot of concern about kind of the resource overload and what's like the quickest, easiest way for people who may not have time to get off work, or people who don't really get a clear message about how to register to vote. We've been putting together small, short emails. And if you want to go to the third slide, it's an example of one of these emails where we've had 3 key points for people. The first one mainly had the dates upcoming. This week is talking more about like where to find ballot boxes. And then next week will just be last minute things of, if you haven't been able to submit a mail-in ballot, where can you go on election day? What are the hours of some of the early voting centers? And we've just tried to make it a simplified way so that someone who reads the email or sees these wherever they may be posted can get some quick resources to registering, checking their ballot status, and making sure that they're able to get their vote in by election day. And as far as reaching out more into the community, we were able to put up posters at the Dawn Free Clinic, which is a student-run clinic. And then also I was doing some work with some other students at Mission Medical Clinic, which is a free clinic in Colorado Springs. So those have been two of more of our community outreach centers. And overall seems to be pretty successful in getting some of these people who have maybe never voted before or were having struggles with registering to vote, helping them register to vote. And I'll just finish off with, if anyone is interested in any of these materials, any of the posters, any of these email templates or links to a bunch of these different frequently asked questions or things that are often barriers to register to vote, please feel free to reach out to me and I can get those distributed, and hopefully they can be useful over the next couple of weeks.
Thank you so much, Jack. I just wanted to share, it's a cute voting story. My husband was filling out his ballot and got off by one bubble. And it was like pretty crucial the way he wanted to vote. Being off by one bubble was, he definitely had to go in. We live in Arapahoe County and it was super easy to go in and vote in person, and they were taking COVID precautions very seriously. So if anyone asks any of you guys, that happened to us, and it was an easy remedy, at least for people that are working from home. I know that some questions have rolled in through the chat. Joe?
Yeah, we had a couple questions. Has the voter or Met Out the Vote been tracking data of how many people they've been able to help register?
Yeah, so we got in. They kind of had a competition between medical schools with medical school students, and that ran from August through the middle of October. But we could still see the tally. Last time I checked was last week, and I think we were about around 350 people either helped to check their registration status or order a mail-in ballot or register to vote.
Awesome. Thank you. And then another question from Julia there to everyone, for you, Jack. It's an innovative partnership, and how could others get involved in this work? Their opportunities.
I think the biggest things right now, we also made some badges through Vot-ER that had the QR code and the text link on them for providers to wear in clinical sites that would permit it. So I think we still have some of those that could get mailed out in the next couple of days. I can, if people want to email me, I can give the link to the Google form that is how you sign up for a badge, and then that would be sent out, and you can have patients or family members, anyone, scan the badge to get to that link. Otherwise, like I had mentioned, the posters or any of these links where people can just click on them, and just mostly just distribution of these materials would also go a long way.
Awesome, thank you. And if you and any of our other speakers wouldn't mind putting your name and contact information in the chat for everyone, so that way people have follow-up questions and things like that, they can reach out to you if that's all right.
We had highlighted the poster in one of our newsletters, so I'll just make sure that when we do our follow-up email to this group and people that registered, that the poster is included, and in that is the QR code as well. So hopefully you guys will super win. I know medical students can be just a little bit competitive with one another, so hopefully we can help you. Up next is Tessa Cushman to talk about the Diabetes Education Program at Tri-County Health Department.
Wonderful, thank you. Mandy, can I get a thumbs up? Can you hear me okay? Awesome. Thank you, Omar, Sierra, and Jack for sharing. Yeah, so I'm here talking about the Diabetes Education Program with Tri-County Health Department. My name is Tessa Cushman. I'm a new registered dietitian, and we really wanted to get the word out about our program, and I'll get into a little bit about why that is in the next couple minutes. So I'll just review the two programs that we provide, and then I'll have a couple of asks from all of you on ways that you can help us. So there's my contact information, and I'll also put it in the chat. And then down at the bottom of this slide, this is our contact information for participants to enroll in our program. So we offer two types of class series to adults only. We have diabetes prevention and diabetes management, and I'll touch on those a little bit more. Oh yeah, you can, yeah, that works. So our program is funded by the CDPHE Cancer, Cardiovascular, and Pulmonary Disease Grant, also known as CCPD. And thus we're able to provide both of our programs free of charge. And we are very happy to do this. We hope in doing this, we can kind of level the playing field and work towards health equity. But I'll talk a little bit about those challenges as we go. So we're currently in our third and final year of funding. Before COVID hit, CDPHE was in the process of pushing the funding to a fourth year in the grant cycle to better align with the state public health improvement plan. Obviously that kind of came to a halt in March. So they'll be revisiting this and making the decision in January of 2021 if they'll be moving forward with it. So we really do want you to refer your patients now while we do have that funding. And our fiscal year goes from July 2019 to July 2020. So almost all of our classes are offered virtually via Zoom now during COVID, but we are offering a few socially distanced classes at recreational centers within our jurisdiction. If you're not familiar, that's Adams, Arapahoe, and Douglas counties. We are also excited that we're now offering both Spanish and English classes for both class types, and we have 2 Spanish-speaking professionals facilitating those. So on the left here, we have our National Diabetes Prevention Program. So for both of these programs, our target populations are under or uninsured folks who are at risk of developing type 2 diabetes or who currently have a diabetes diagnosis. And we serve the Tri-County jurisdiction, though now with COVID, we've kind of opened our doors to anyone who finds out about our program. And previously, we did a community needs assessment, and we found that the geographic locations of Southwest Adams County and along the East Colfax corridor are our priority locations based on needs. However, we don't do income screening, so we don't really turn anyone away, but those are our target populations. So on the left here, we have our National Diabetes Prevention Program. We use the CDC curriculum and we base it off of the program, but we do call it Journey to Wellness because we realize that, you know, a lot of people don't realize they're pre-diabetic. Over 90% of people who are go undiagnosed. So we are able to catch a lot more of those folks by labeling it Journey to Wellness, right? Using those buzzwords that catches people's attention. And if you're not familiar with NDPP, the program is designed based off of a nationally known research study conducted in 1995. It had over 3,000 participants, 45% of participants were African American, Hispanic American, American Indigenous, and Asian American. This was done to represent those higher risk populations. And there were 3 treatment groups, lifestyle changes only, lifestyle changes plus metformin, and metformin therapy only. And the study found that a weight loss of 5% of starting body weight showed as great as 58% reduction in type 2 diabetes incidence rate. So this is what the curriculum is designed off, is that study. So our program, we have full CDC recognition and we use the CDC curriculum, like I said. We facilitate with certified lifestyle coaches. A few of us are registered dietitians, but not everybody is. The program is 1 year long. We start off weekly 1-hour sessions, and then we go into every other week, and then we end the program with monthly sessions, kind of to wean our participants off of the program. And then our goal, like I said, is that 5 to 7% of weight loss of starting body weight. And I just want to note that although weight loss is the measurable metric that we report to the CDC, we really focus on behavior change. So increasing fiber and vegetable intake and increasing physical activity to 150 minutes per week. There's more studies coming out that show that it's that behavior change that shows improved health outcome, and weight loss is just a side effect. So currently we have enrollment open until October 31st, or hopefully if we get that 4th year of funding, we will be able to start enrolling people for the following year. And then on the right here, we have our diabetes self-management education. We label this diabetes self-empowerment because that is really what we're doing. We're empowering individuals to take control of their diabetes diagnosis. We're giving them the tools and the resources that they need to feel more confident with that. So this is a much shorter program. It's 8 hours of curriculum. When we were in person, we were doing 4 2-hour sessions. Now with it being online, we have 8 1-hour sessions because Zoom fatigue is real. This program is recognized by the ADA, the American Diabetes Association. We cover topics like disease process, monitoring blood glucose and target ranges, healthy eating, physical activity, acute and chronic complications, and psychosocial issues. These are facilitated by registered dietitian nutritionists. And then going back to the left side here, last year in our 2019-2020 fiscal year, we saw an average weight loss of 4.2% of all participants and 5.1% of those eligible participants. And then on the right side, we saw an average of 0.89 reduction in A1C, and at a national level, we're seeing a reduction in 1% of the A1C. For our NDPP program, we accept all people, but we do give priority to people with pre-diabetic diagnosis. So our diabetes self-management, we have rolling classes until next summer. Next slide, please. So lastly, how you can help, you can share our flyers to your patients and clients. Mandy, maybe we can get those in the newsletter as well, or we can send those out, or you can feel free to reach out to me to access those flyers. You can refer your patients or anyone that you're serving that you would feel is eligible for the program or could benefit for the 2 programs. Spread the word to partners that you know about. And then we are conducting key informant interviews with several community-based organizations and primary care physicians. So if you're interested in participating in one of those, you're already a step ahead because you know about the program, but we would really love to get your feedback. So again, enrollment information is down at the bottom, and I will put my contact information in the chat. Thank you.
Perfect. Thank you so much, Tessa. Joe, questions?
Yep, I did have a question come in. The question is, how does a dietitian switch the focus to health and body positivity and body acceptance rather than focusing on weight loss, even though that's the metric that's used?
Absolutely, that's a great question. So I just started a couple of new classes this week, and I like to tell the participants that you know, it's really about that behavior change. Like that is the most important part. That is what is going to improve your health, and weight loss is just a side effect of that. I tell them if it were up to me, we wouldn't be, you know, tracking weight loss throughout the year, but I tell them, you know, feeling better, having more energy, those things aren't measurable. So that weight loss is something that we can measure and report to the CDC. So I'm very transparent with participants, just like I am with all of you today. And that seems to be received very well.
Thank you. Yeah, and then another question came in. Do you expect a spike in diabetes due to inactivity because of the pandemic, or even have you seen that trend since the beginning of the year?
That is such a good question. I don't know that there's enough evidence out there quite yet, but I do think that that's probably a good prediction. We also, we're having actually lower participation in the virtual classes, which might seem a little bit backwards, but I think just with the transition of going virtual, it's been a struggle to advertise to folks online. So that's why I'm asking all of you to help. And then going off of that too, we know that folks with diabetes do see more severe COVID symptoms. So, just telling our participants that they have to be extra diligent, extra careful, and just making them aware of that.
Sure, thank you.
Okay.
Oh, sorry.
No, sorry. Thank you so much. Thanks to you, Tessa, Jack, Sierra, and Omar for completing our Did You Know panel today. Next up, oops, maybe. Our discussion groups. We're going to break you out just to network. It's a low pressure thing just to connect with one another. A guided question is what stood out during the panel, or you can just meet and share who you are, what you do, and how you all can connect with one another. Let's set that at 10 minutes, then we'll come back and do some report out, just minor, no pressure again, report outs. And I think they're happening right now. So see you in 10. Welcome back, everyone. Here's an opportunity if you want to share what your small group talked about. We heard a little bit of overflow for how the Juvenile Assessment Center is awesome, and hopefully you guys can join us for a Did You Know panel to share everything that you're doing. My group learned a little bit more about the CU Department of Jamil, help, I can't do it. There's three
Diversity,
things.
equity, inclusion, and community engagement. Sorry, it's a mouthful.
I know. I need to get an acronym down, but then somebody at AHA will say, don't use acronyms. So I need to memorize. So we're looking forward to, we're actually highlighting what that department is doing in our December newsletter. And Jamil and I are connecting offline for a future Did You Know panel. So one group covered. I'll lean heavily on board members if there are no volunteers, just to share a little bit.
Well, if I can jump in.
Hey, Dennis.
Again, I'm Dennis Streeter with, I'm the vice chair of the Diversity and Inclusion Council with the Aurora Chamber. Because of that, I created the Our Community Broadcasting Network, and I'm doing video podcasts to really show off and promote the good and great work that's being done throughout the Denver, Aurora area. Omar has agreed to be a guest, so he's going to be an upcoming guest. Mandy's been a guest down there talking about the Aurora Health Alliance. And actually, Judge Day from the Wellness Court, he's going to do an interview with me in a couple of weeks.
That's wonderful.
But anyhow,
Judge Day was on our last panel.
That's right, from the last panel. And I, again, would invite everybody, I'll put the website up in the chat, but please take a look at this. And if you want to come on, if you have or know of somebody or an organization, this is, again, to promote what you're doing. This is not, journalism, a gotcha journalism type thing. I'm trying to highlight and promote, again, some of the wonderful work that's being done for our greater community. So again, look in the chat, go to the website. You can see the format. I do all the interviews now on Zoom fully edited. We walk through it. You get editorial jurisdiction over it, and then we get it posted. And actually, Aurora Health Alliance has posted several of my interviews as well. So anyhow, the invitation's out there.
Thanks, Dennis. What everyone else talk about, or some of you?
Well, Allison Somerton here. I'll talk about at least what I talked about in our group. And I think other
Face to a name. Yay, Allison. We've been
Yes. So Allison Somerton here with the Connect Aurora, which is also part of a program within the Aurora Mental Health Center. And we provide health insurance enrollment assistance. We assist with Medicaid, CHIP, and Marketplace. And I just want to remind folks that Connect for Health Marketplace Health Insurance is starting November 1st. So if you have any families who have lost health insurance and missed a special enrollment period, we can get them signed up November 1st through January 15th. So we have a window there up from November 1st to January 15th. You can help clients make appointments by going to connectaurora.org. Of course, you can sign up for Medicaid and CHIP anytime, but Marketplace, we only have a special enrollment period. So if you have any clients who have lost coverage during COVID, please send them our way, connectaurora.org.
Could I chime in with having Alice, this is Molly. Because of the public health emergency, people have been able to stay on Medicaid through the pandemic. That continues through the end of March. But at the end of March, everybody who's been staying on Medicaid because of the pandemic is going to have to be reevaluated.
Well, I just want to correct, sorry, I don't mean to correct.
No, please.
But actually Medicaid at the public, those extended continuous eligibility ends at the end of January. So,
No, I just got this morning, the 31st
okay,
of March.
sorry, I didn't mean to.
No, I thought it was,
I'm using the website on, so the increased enhanced reimbursement rate goes until the end of March, but.
Okay. Oh, okay.
But not the eligibility. So continuous eligibility.
So tell us about that, because it's going to create a
Yeah,
huge cliff with people
does.
falling off that don't even know.
Well, what will happen at the end of so during the public health emergency, states in Colorado was not doing redeterminations or telling people that they're no longer covered if their income went over. So those folks have been able to retain coverage all this time, which is absolutely wonderful. However, the continuous eligibility period, at least right now, it can change if the federal government extends a public health emergency, extends till the end of January, which means people will start getting redetermination notices, probably the end of December, early January, which means they will be given the opportunity to providing information about whether their income is, what their income is, so that they can requalify for Medicaid. But that will be anywhere estimated maybe 70 to 90,000 in Arapahoe County and another 60 to 70,000 in Adams. So we're talking about a large, those numbers, again, ballpark, but so when you have anyone come to you, please encourage them to open their mail, because as Connect Aurora, we find a lot of people haven't opened their mail. They come to us after their Medicaid's already been closed. They've gone for services and found out they don't have Medicaid. So please send them to connectaurora.org or back to the county, but please encourage them to open their mail, because there's so much mail, they forget about it, they tuck it away, and they don't reply and don't provide the information that's required.
Is there anything we can do as helpers in the community to forestall this disaster? Can people look now and make sure they'll stay, or
absolutely,
what can we do to prevent a lack of access to healthcare?
The most important thing is to encourage them to open up their mail.
I know.
No, seriously, because they can go into their peak accounts in December, if they have one, or January, and update their information. or they can reply, send the mail back to the county, or drop it off at the county. Just drop off the paperwork to say nothing has changed, or this is my current income, and here are my pay stubs. They can submit that to the county. They can submit it on Peak. If they have trouble doing that, we can also help them.
Great.
Keeping your information up to date in your Peak account, but people do forget that, but that's very helpful. If they have a Peak account already, that's very helpful for them to do that.
Thanks. We all need to help with that. Thank you.
We
Thank
all
you,
do,
too.
exactly.
Quick
And we'll be
question.
helping, Allison will be helping, ACAN will be helping highlight all of those resources in the following 3 Aurora Health Alliance newsletters. So keep a lookout for that. Some people are dropping some updates in the chat, so just wanted to bring people's attention to that.
Did somebody have a question? I thought I heard someone start
Yeah,
that.
I had a quick question. In
Yes.
regards to people updating their information, and I know this may not be for the majority, but just for some, we are seeing the increase in homelessness or people facing transitional housing and things of this nature. What is the best remedy for them to be able to keep up their services, but at the same time may not be contacted by, are there satellite locations? Just what are some of the things that they can do who are struggling with housing right now?
So if an individual does not have housing and address, they can keep a Peak account and adjust that information on their phones if they have a phone. And so that's one of the best ways to do, because you can get all your notices either by email or text.
Okay.
And again, if anyone has trouble setting it up on the phone, we can help them with that. You can send them to connectaurora.org or go to any one of the health clinics which help with Medicaid enrollment.
Thank you so much.
It has health enrollment specialists. All the Denver health clinics have health enrollment specialists. So Connect Aurora offers both in-person and virtual and help, and so do a number of the clinics as well.
Thank you, and thanks for being available to answer these questions. Any other highlights from discussion groups?
And this is Rich on the AHA board, and in our group, we kind of saw the connection between Omar's discussion and the pregnancy center, diabetes, and voting, because it's all will kind of a part of the question that he asked: what are we going to do as part in our community? Because we just can't rely on the feds. So those organizations are doing something, and what really impressed us is our students on the Anschutz campus, that they're so busy with their studies, yet they're taking time to be a part of the community and contribute, whether it's working at the Dawn Clinic or in the voting, the Vot-ER program. That really impresses me, that and gives me hope for the future, that our young people are out there making a difference. Yeah, they're building their careers, they're doing their personal studies, but when they're out there volunteering like that, whether it's voting or working within the clinic environment or other things that they're doing, it just encourages me and our group that we have young people out there that want to do something and want to be positive and contribute to their community, not just study all the time like I did when I was in school.
All the time, Rich? Nonstop? Yeah. Me too.
Yeah.
There are any other updates or summaries from your discussion groups? Now's your chance. Otherwise, I'm just rotating back and forth on the slides between upcoming meetings that the Aurora Health Alliance is putting on. Other than that, you guys, thank you so much for spending your afternoon with us. Zoom is a way that we can convene. We look forward to this pandemic being over and getting together in person. But until then, see you in Zoom land next time.
Thank you all.
Bye.
Thanks, everyone. Get your flu shots.
Vote.
Vote.